trocars are positioned as shown. The left lobe of the liver is lifted using a stick placed by P3. The gastric fundus is pulled to the left with the P5 clamp. The right crus of the diaphragm is identified and dissected. The posterior dissection of the esophagus is completed. A Penrose drain is inserted, clipped and held to the left using the P5 clamp. The mediastinal pleura and the posterior vagus nerve are identified, and the ascending dissection continues in the avascular plane between them. The left lateral face of the esophagus is released from the diaphragmatic crus. Once the dissection of the angle of His has been completed, the esophagus is lifted by P5 so that the right border of the gastric fundus can be pulled to the right by P2 traction, while P4 grasps its left border, enabling a fundoplication without torsion or tensioning. The fundoplication suture is started by bringing both borders of the gastric fundus together over the anterior surface of the esophagus. The same fixing procedure between the esophagus and the two borders of the gastric fundus is performed above the fundoplication line.